Hi there, you're welcome to DamiRx Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content here on our YouTube. Also, you'll be able to support us here on our YouTube channel by hitting that like and subscribe button. And also, as a gift for you for subscribing to our channel, you can hit the link down below in order to download a free healthy meal recipe that we do have here on DamiRx Care. Thank you and bye-bye. Hi there, you're welcome to DamiRx Care channel, and our medication of choice today is known as Premarin. So Premarin is also known as conjugated estrogen. So this medication is used mostly in patients who are experiencing post-menopausal symptoms such as vaginal thinning, vaginal dryness, which are most commonly postmenopausal symptoms. Also patients who are noticing like any uterine bleeding due to like an hormonal imbalance, they would recommend it in those patients, as well as patients who are noticing any painful intercourse, which is also known as dyspareunia, which is a medical term. They will recommend this medication as well. This medication may also be used in male or female transsexual. This medication, like I said, is an hormone, which is it contains estrogen, and this medication can also be used in prostate cancer as well as metastatic breast cancer. So as I said, this is only for metastatic breast cancer, not just any kind of breast cancer. So it can also be used in patients who have post-menopausal osteoporosis as well. So this medication does come in tablet as well as vaginal cream. It also comes in injection powder as well. So usually with the dose of this medication, it kind of varies depending on what the doctor is treating. So for patients who are taking it as a postmenopausal symptoms relief, those patients are usually on a 0.3 milligram tablet a day, or the patient might be using the cream as well with the vaginal applicator. In terms of patients who are using this medication, most especially in transsexual or prostate cancer, usually they'll stay on about a 1.25 milligram tablet a day. And while for patients who are taking this medication for metastatic breast cancer that are hormonal related, these patients will usually take about 10 milligrams 3 times a day. So as I said, it kind of ranges between 0.3 to 10 milligram that tablet that patients usually take. So depending on what the doctor is treating, your tablet or your dosing might be different. So what are some side effects of Premarin? So side effects of Premarin include swelling. So this medication can cause like your peripheral swelling, which would be like your lower limb area or your leg swelling. This medication can also cause abdominal pain. It can cause stomach pain as well as diarrhea. It can also cause bloating, gas, stomach cramps, backache. It can cause migraine, headache, nausea, and vomiting, as well as change in hair growth or weight. So usually in patients, this symptoms are not all inclusive, or side effects are not all inclusive. It really just depends on how well your body is tolerating the medication. That would depend on what is causing that side effect or not. So usually I recommend kind of taking the medication for a couple of weeks to see how well your body is tolerating it. If you're feeling great with it, then I will go ahead. Most especially for patients who are using this for postmenopausal symptoms, this can be a very hard stage or hard season in a woman's life, and this is usually very important that you're feeling as comfortable as much as you can, and this medication is able to provide benefit in those patients. Also in patients who are needing an hormonal therapy just to kind of balance out their hormones, in the transsexual, maybe the prostate cancer as well as the metastatic breast cancer, this medication can help kind of balance out the hormone and help in whatever the doctor is trying to treat the patient for. Also, let's talk about patients who are not able to or who should not take this medication. So patients who have like an abnormal undiagnosed genital bleeding, this medication would not be recommended in those patients. Also, patients who have maybe like a stage 1 or stage 2 breast cancer, except if it is in metastatic breast cancer, then you should not be taking this medication for breast cancer. Also, estrogen is known to have a great or increased risk in cardiovascular or heart diseases. So patients who have an active DVT, or which is also known as deep vein thrombosis, which is a condition whereby there's a clot in the leg, this patient should not be taking this medication. Also, patients who have what they call pulmonary embolism, or PE, where thereby there's a clot in the lungs, this is not an appropriate medication for those patients. Usually we would not recommend estrogen in patients who are having a cardiovascular or heart disease. So patients who are having an active stroke or heart attack, this medication would not be recommended in those patients. So also in patients who have an active liver disease, because this medication is broken down in the liver, we would not recommend you taking that medication. Also, patients who have maybe who have a condition called estrogen dependent neoplasia, or a protein C or S antithrombin deficiency, or patients who are pregnant, this medication would not be recommended in those patients. So what else do you need to know about this medication? So this medication should be taken, most especially if you're taking the oral tablet at the same time each day. Also, in patients who are pregnant, this medication may harm the unborn fetus, so we don't recommend you taking this medication if you are pregnant. Also, due to the risk of osteoporosis in patients, most especially taking it for post-menopausal symptoms, the doctor may recommend this medication in addition to a vitamin D as well as a calcium, in order to prevent any bone fractures or bone loss that is accompanied with aging in women as well. Also, in patients, if you start noticing any abnormal breast lump, if you start noticing any breast discharge, this could be in male or female, you want to make sure that you're reporting that to your doctor. Also, if you start noticing any chest pain, breathing, or trouble breathing, or coughing of blood, you want to make sure that you're reaching out to your doctor immediately as well. Also, in patients, if you start noticing any numbness, weakness to one side of your body, or any unusual vaginal bleeding, any vision changes, yellow skin or eyes, this is usually with the yellow skin, this is usually patients who have maybe jaundice, or maybe their liver is not reacting well to the medication. Then you want to make sure that you're reaching out to your doctor as well. For patients who are having any abnormal consistent hand, ankle, or feet swelling, or rapid weight gain, if it's not favorable, then you want to make sure that you're reaching out to your doctor as well. That way they can recommend other substitute that will work as well for that condition that you are having. So for patients who are using the cream, you want to make sure that you're washing your hands before and after applying this medication. So you want to make sure that you're using the cream only in the vaginal area, except advised otherwise by your doctor. But most likely this medication should be going in the vagina. Also, you want to make sure that you're washing your applicator, not with hot water, but with a warm or a mild soap. So warm water with mild soap, you can kind of just juggle that applicator in there to make sure you're getting rid of any germs. That way you're not introducing it into your pubic area. Also, with this medication, you want to confirm that there are no drug interaction with any other drugs that you're taking by asking or confirming with your doctor or your healthcare pharmacist as well, to make sure that this is an appropriate medication for you to be taking. Also, while taking this medication, you want to avoid using any douche or any other vaginal products unless you question your doctor and it says it's okay for you to do so. So I hope you were able to learn one or two things regarding how to use this medication safely and properly. If you did enjoy this video, make sure you give it a thumbs up, and you can also subscribe to our channel just in case we are posting any medication that can interest you. That way you can get alerts anytime we post other educating videos and contents here on our YouTube channel. And you'll also be able to support us here at DamiRx Care. We also offer other medication consultation services. So if you have any urgent question regarding a medication or a condition that you have, make sure you're reaching out to us at www.damirxcare.com. All right, we look forward to seeing more of you here on our channel, and stay tuned.